All right, let's dive into this. The NHS waiting list crisis is like a storm that's been building for years, and under the new government, it's still raging, fueling massive frustration across the UK. Imagine this: over 7 million people, 7.37 million to be precise, waiting for routine hospital treatment as of mid 2025. That's more than the population of Scotland, just sitting there, in pain or uncertainty, waiting for their turn. And this isn't new. It's been climbing since the pandemic hit. But now, with a new Labour government in charge since July 2024, people expected change, and they're not seeing it fast enough. Let me paint the picture for you. First off, the numbers are staggering. Back in 2019, before COVID turned everything upside down, the waiting list hovered around 4.5 million. Then, hospitals shut down elective care to handle the emergency, and bam, it's doubled. By September 2023, it peaked at 7.77 million. Sure, it's dipped a bit to about 7.36 million now, but that's still the lowest since March 2023. People from all walks of life, working age folks making up 56%, the elderly at 33%, are stuck. Women, often waiting for gynecology, face longer delays than men. And get this, those in deprived areas, especially Asian or Asian British backgrounds, are hit hardest, waiting over 18 weeks more than average. That's not just stats, it's inequality baked into the system, and it's fueling anger, because why should your postcode dictate your health? Now, add healthcare chaos to the mix. The NHS is stretched thin. Staff shortages, outdated tech, and a backlog that's not just elective care. We're talking cancer waits, where the 62-day target from referral to treatment hasn't been met in years. In March 2025, only 71.4% hit that mark. Diagnostics, people waiting months for scans or tests. A&E, 40 hours or more for some, with over 39% waiting past 4 hours last April. Ambulance response for heart attacks, over an hour and a half on average, against an 18-minute target. It's chaos because demand's exploding, people putting off GP visits during lockdowns, now flooding in, while capacity's lagging. NHS England's delivering more appointments, over 4.6 million extra since July last year, but it's like bailing out a sinking ship with a teacup. Strikes? Oh, that's the spark to the frustration powder keg. Junior doctors, now called resident doctors, are striking over pay. They walked out for 5 days in late July 2025, demanding a 29% raise after years of real terms cuts. And they're not alone. Nurses, paramedics, they've all been out. These strikes aren't just about money. It's about burnout, unsafe workloads, and feeling undervalued. Last month's strike meant 11,000 more appointments went ahead than the previous one, but overall, they've added to the delays. Experts warn it'll stall the progress we've seen. No quick fixes, that's the harsh truth. The government's talking big, a 10-year plan, neighborhood health centers, targeting deprived areas first. They're diverting billions from other spots to cut that 240 to 330 billion pound sickness cost to the economy. But Daniel Elkis from NHS Providers says tackling disparities is front and center, yet it needs time. Wes Streeting, the health secretary, boasts of cutting the list by over 260,000 since July, crediting extra appointments and reforms. But critics like the Nuffield Trust point out misleading stats. Waiting lists drop partly from unreported removals, where people die, get sicker, or pay privately. Nearly 3 million a year vanish that way, masking the real scale. So, is it progress or smoke and mirrors? The frustration's boiling over. People are checking phones daily for calls that don't come. Symptoms worsening, lives on hold. Social media is ablaze with stories. One guy's waiting a year for knee surgery, another's wife deteriorating from cancer delays. And the cost? Not just emotional. Economically, it's huge, with folks off work. Private care's surging. 3 million unseen patients since referral, pushing many to pay out of pocket, creating a two-tier system. That's not the NHS dream. Under this new government, they've got ideas, faster access via plan for change, but it's fragile. Strikes threaten reversal, and without fixing root causes like staffing, doctor numbers up 26% in 5 years, but vacancies at 6.7%. It's no quick win. So what's next? More data transparency, like breaking down weights by age, sex, ethnicity, deprivation, published this July to spot inequalities. But will it help? People want action now. The UK's fuming because promises of a fair, free at point of use system feel broken. We need to keep pushing for reform, but let's be real, it'll take years, not months, and that's the bitter pill. So, where do we go from here? It's a tough spot, but the NHS is worth fighting for. We can't let frustration win. We need action, patience, and pressure on those in charge to make real change happen. If you've... Static. Hang on. Looks like my mic's cutting out. Anyway, that's the reality of the NHS crisis right now. If you're fired up and want more updates like this, do me a favor. Subscribe to the channel. It keeps us going.